All right, so a lot has happened since my last full video. My last video was the day after my axillary node dissection on October 7th, is the last video I did. I did do a short, but that's the last full video. So my first week of recovery, I should say, this is Friday, October 17th now. So I'm 11 days after surgery, and a lot has happened in the last 48 hours. So the first week of recovery went pretty well. The drain was a pain in the ass, as they are. But everything went pretty well. My incision looked good. It was a lot different than last time because I had a lot more, like, I think, emotional aspects to it. Losing my breast, the fear of just not knowing, what is the incision going to look like? What am I going to look like? How am I going to feel? What's the drain going to be like? Am I going to need opioids? Like, all those questions were there. This time I was kind of like, I got this. Like, this is the same as last time, but easier in a lot of ways. So my surgeon, oftentimes they go up into the armpit to do this surgery. However, because I already had a new incision and because he wanted to access the chest wall as well to scrape that and make sure that there was no cancer left on my chest wall, he went through the same incision. Great, easy peasy. So the first couple inches of the incision here from first time weren't cut through. So there's some there, and then the rest of the incision. So as you saw, the surgery went well. And yeah, it's been a lot. So Wednesday, I called the extramural nurse and said my drain had been under 20 mils in 24 hours. And as well, it was day 9, so my staples could come out. So great. So it was the same nurse I had had for the first surgery. She happened to be on call yesterday. Really super sweet, lovely, so nice. Allowed my daughter to watch because my daughter was really interested, and she was really good at making sure she didn't like get too close for germ reasons, but allow her to be engaged and kind of ask and watch mommy. So that was great. So that was about 7 o'clock, just after 7 at night. Felt so good. Put, my compression bar back on, had a little bit of gauze and such over the drainage hole. Everything looked beautiful. I ran to the dollar store and the Shoppers for a couple things. Nothing heavy, nothing. Got back home and my daughter was about to go to bed. And I went into the bathroom and looked down and was like, is that blood? That ain't good. And looked, and my incision had opened a lot. So I called extramural right away and was like, hey, can I have the nurse call me back? Because, like, this ain't good. And she called back, like, in, 3 minutes. And, of course, she wasn't able to see it. And so she was like, oh, do you think you can cover it with some steri strips? And I'm like, nope, this is not. I think she thought, like, oh, there's, like, a teeny bit of blood. And I was like, no, this is not a steri strip situation. So she was really lovely and was like, you can cover it with some gauze tonight and, like, we'll assess it in the morning. And I was like, honestly, like, you can't see it. This is not a cover it with gauze situation. And she was like, oh, okay, like, no problem. Then go to the ER. And I was like, okay, I'll go to the emergency room. So because it wasn't like a heart attack symptom, like, I did take about 15 minutes, grab some books. I brought a blanket and a pillow, and I got stopped at Tim Hortons and got a coffee on the way because I'm like, I'm going to be there all night, right? Like, I'm low priority. This isn't a life or limb situation. Like, I'm fine. And I got there. It was about 20 minutes to triage. There were 2 LPNs in the waiting room, like, checking on people, but I was like, I can wait my turn. I was the next person to be triaged when I arrived. So I took a number, and the triage nurse was super nice and was like, hey, like, and she was so lovely and was like, you've been through a lot this year. This is, a lot. And she was like, we can, we'll get you fixed up. And she was like, can I look at it? Like, can we go to this private space so I can look? And I said, of course. Like, and I looked, and she was like, yeah, you're not exaggerating. Like, that's no, because I was very like, I don't want to waste her time. And she's like, girl, you need to be in the ER. Like, this is a thing. Which helped because part of it is it's here. So it's like hard for me to see. So I was checking with mirrors, but I did show my partner Kelly, and he was like, you need to go to the hospital. And I was like, okay, but it was kind of hard to see. I needed to go to the hospital. So, yeah. So anyway, the ER nurse was lovely, and she was the triage nurse, and she was like, I'm gonna check who's on call for surgeon tonight. And she said probably they'll send like the surgical resident come stitch up. But it happened to be my surgeon on call that night, like such great luck. So he called, and she was like, he knew who you were right away. And he said, look, I can see her first thing tomorrow morning. This was about 11 o'clock at night. So he said, can you pack it with wet sterile gauze, seal it up, and I'll see her in 10 hours, because that way I can make a decision. And I was like, no, I'm totally comfy with that. I don't mind having a registered nurse properly sterilely like gauze and do it up. I was not steri-stripping this thing because like steri-strip fell into it. It was bad. I should warn people this might be a gory one. I won't show anything on this, although I do want to have a way that folks can see it if they want to. But anyway, yeah, so gory discussions. Should have had a warning. Yeah, so went home, was like, crap, I drank half a coffee because I assumed I was going to be there all night. I was in and out in 75 minutes. So fantastic. Because I didn't need to be seen by a doctor because a doctor had cleared. She had talked to the doctor and he had cleared to do this. So, clean, gauzed it up, sent me on my way. So the next morning I went to my surgeon's office at 9 a.m. I was the first patient he saw, and he just took a quick look and was like, yep, that is open. And so he kind of like put the dressing back up and said, there's this vacuum thing. The extramural nurses can do it. I'll write an order for it. They pop this on, heals it right up. And I'm like, cool. I didn't know what I was getting myself into. Spoiler alert. I have a friend. So I had no clue what this meant. Like, he was like, you put this vacuum thing on, easy peasy. And I'm like, cool, I don't know what that is. It's a machine that I have to probably have for 2 weeks. Originally, he had said probably a week. I just spoke with the nurse navigator at the hospital, who's amazing. And she was like, probably a couple weeks. So we'll see. Again, it just depends on how quickly I heal. I'm youngish, healthy, have no healing disorder things, don't smoke, don't have diabetes, all those things. So I'm in the best position to heal properly. But so the nurse called me, a different nurse I hadn't met before, and came over, and she could not have been nicer. Like, so lovely. Everything you want in a nurse. She, let me get comfortable. Even I was laying down on my couch and like, let me get like blankets. Cause I was like, can I have a minute to put blankets so I'm not like laying on the sticky couch with no shirt on? She said it's, can be painful cleaning it and then putting the vacuum on, especially at first when you're not used to it. So she asked if I had any pain meds, and I did say I had some codeine. And so she was like, would you like some? And I said, yeah, actually, you know what? If you're going to be digging in my incision, like, cool. So she went and got it, got me water, was so lovely. And I said, like, look, I hate to even ask permission because it's my body, but like, can I take pictures of the hole? And she's like, I gotcha. So she took like 4 pictures from different angles, which was really nice because again, sometimes it's just a vibe healthcare providers give you. If they're like super nice, then you're willing to ask. Because some nurses I would have been like, oh, I don't want to bother them. But she was so good. And even as she was cleaning it, she was like, I'll give you a little break because, this is a lot, and gave me breaks and took her time. I know healthcare professionals are really, really busy, but giving you like a little bit of time to like breathe because you're digging in my incision, super important. So like 5 stars, great, was fantastic. But she realized like I had no clue what I was getting. So she went over everything and I was like, what? So I traded my drain for a vacuum and I am pissed. This was not the trade I intended. So what it is, she put like some kind of dressing around on my skin so that the vacuum doesn't irritate the skin that's there. But it was, and again, gory part, she had to measure it. So she had a sterile little measuring Q-tip type thing. So across this way, it was 5 centimeters at least. Yeah. this way, like up and down, like how big here, was 2 centimeters, so almost an inch. And it was 4 centimeters deep. So that doesn't mean quite like in like this, but like angled a bit because it went into my armpit. So yeah, that's big. Yeah, so that sucks. So, so she put the dressing on it around this kind of thing to protect my skin, put this on, and then it's like, I will show, it is, if I can show here, like a vacuum tube thing. Very nice. So the tube comes out the bottom of my shirt. She asked if I wanted the top or the bottom. And I was like, I'm already used to a drain coming out the bottom, and that I don't want to have like a tube up around my head. Anyway, so we have that. And they do give you quite a bit of tube, which I really appreciate because, you know, you want to be able to set it somewhere. And then I have this little machine. Take it out of its little carrying bag here. It also fits in one of my purses, so when I go out, I'm going to do that. But it's this little machine. So it's got a spot for drainage because it is draining some, but the drainage has like some kind of powder in it, so it's not like liquid in there. Yeah. Very nice. So it is, if anyone's wondering, the vacuum therapy is at 125 millimeter gigahertz, I'm guessing, mmHg. So yeah, so this is all covered, which is nice. There apparently are like pico dressing type things, and I just, if I had known this was coming, I think I would have investigated that in my insurance and things, but at this point I'm like, whatever, let's just get this done. But this is all covered, like I didn't have to pay for any of it, just like the nursing home care, all that's covered by my provincial government. I'm sorry to any Americans or other people watching that don't have public health care. But yeah, so they give you quite a bit of cord, which is good, and they give you this like nice little carry bag. So it's good. I slept with it for the first night last night, and it was not as bad as I anticipated. I have been sleeping on my left side. My surgeon said prioritizing sleep is more important than, like, you know, some people are like, you have to lay, you know, inclined on your back, not move. And he was like, people don't sleep like that. And so he is more of the, it's better if you know you're going to end up sleeping on your side to like do it safely and that kind of thing, rather than just rolling in the night. So I've been sleeping inclined. I still have like a wedged pillow, so inclined, but holding a pillow, like a really soft pillow. And so that was good last night. I was able to do that and get some sleep. My cat is trying to get in. Yeah, so that is the story of my vacuum buddy that I got. So this was not anticipated. My doctor mentioned it, but I didn't know what it was. He mentioned it like 2 hours before I got it. I'm saying I didn't have much time. But I had Googled it like 20 minutes beforehand, and that's when I realized it was going to be a machine. So I get it. There was no warning because this was a sudden complication, but I had no time to process. So yesterday was really, really hard. I was really angry. Not at anyone. Like, even the nurse who had removed my staples called to check on me and was like, I'm so sorry, like, it looked good. And it's like, it was. Like, it's not you. Like, these things happen. I'm not upset at anyone. I'm upset at the universe. I'm not upset at anyone. Like, my nurse that removed my staples did everything right. Everything looked good. There were no concerns. She, put on steri strips, all that. Everyone's been great, but it does really, really, really suck. So there's that. The other big thing that has happened is, as I was at my surgeon's office yesterday being like, what are we doing with this? His receptionist, who is just amazing, walked in, and said, like, your pathology results like came in like now. They just came in, which is amazing timing. So got my pathology results. So there were two things, like I had said previously. So there was that the portion they removed from my breast, if you kind of imagine like this is the breast being removed, there was no cancer on the skin. So all the skin was fine, which is good signs that it didn't infiltrate there. But on the back, the tumor itself was 3 millimeters, so quite close to the back, but not all the way through. But there were cancer cells on the back. So My surgeon had said he had not been able to see anything into my chest wall, so he was kind of surprised at that. But again, like one cancer, we don't know how much cancer, we just know there was some. So it could literally be one cell that was hanging out there. So he said, since we're doing the surgery again, he's like, I'm already opening you up. Let's get any additional tissue. So he said he was going to get tissue both from like this skin here on the outside, take a little bit more of that skin, scrape tissue, and scrape on my chest wall. The good news is there was no cancer cells through that. So no cancer cells in my, on my chest wall at all, which is really good news. So it quite possibly was that was the very last cell. Even if there was a cell somewhere missed, that'll be caught by radiation. So we're not concerned about that. Originally I had 4 lymph nodes removed and all 4 had cancer. 4 had more than 2 millimeters of cancer and, or sorry, 3 had more than 4 millimeters of cancer and 1 had between 0.2 millimeters and 2 millimeters. So significant amount of cancer, which is why we assumed there were more. So this time they take out kind of a glob of fatty tissue is how he described it. They don't kind of count the lymph nodes. They just take a chunk out. And so there were 11 taken out and 4 of them had cancer. So I'm really, really glad I did the second surgery. 3 of them had the macromastosis. I can't say that word properly, but the bigger amount. And 1 had a micromastosis. So essentially meaning like less than 2 millimeters. That farting noise is the vacuum machine. Very happy about that. So the good news is 7 didn't have any, right? So, but that does mean in total I had 8 lymph nodes with cancer of 15 taken out between the 2 surgeries. So I mean, that's scary, 8, but having 4 or 8 is still within the same like class. So it still means that I'm by the tumor node mastosis grading, I am still at a stage 3A. There is new grading, and I'll comment on that in another video, that takes into consideration your estrogen, progesterone, and HER2 status and your grade of your tumor. That gives you a different staging, which is better. So anyway, so I'm still a 3A on the like normal scale. So whether it was 4 or 8 keeps between it, because it's 4 to 9 is that staging. So, but at least they're out of my body, right? Like it would have been upsetting to me had I have came out of this and there was no cancer in any of those lymph nodes, or just like 1 with a micromastosis, because radiation would have covered that. But it makes me feel better about having done this second surgery, especially getting the whammy of you're gonna have this vacuum thing for a while. Knowing that at least it was worth it, that I got more cancer out is good. It's good. I'm still upset both about having the surgery and this vacuum dealio, but that's okay. So yeah, so pathology report. It's funny, the first pathology report was like, there's 4 cancerous lymph nodes, and I was horrified. And this one, there's 4 cancerous lymph nodes, and I was happy because it could have been 11, right? It could have been 11 cancerous lymph nodes this time, and it could have been still on my chest wall. So 4 of 11 is good. I mean, not that any cancer in your lymph nodes is good, but so the hope is that it spread through those 8 and then didn't get any further. That is the hope. We're going to be doing radiation on the area anyway, in case there were any stray cancer cells there. That's another thing. All 8 lymph nodes, it was contained within the lymph node. So lymph node's like a little bean type thing, and the cancer can grow out of the little bean. None of mine did. So all of mine, the tissue around the lymph node had no cancer. So that's also a good sign. So, yeah, so that's that. So I have this vacuum for a while. It's going to push off radiation, because how the nurse navigator today described it, because I was like, how long does this push this off? And she was like, well, you were, 10 days into healing and you had to start at square one again. So it's at least that long, which makes sense, right? Like it is, because I hadn't really thought about it that way, but it's like, right, like I got reopened, so I started square one. So it's going to mean I'm going to be doing radiation in the winter, which I'm really upset over. You know, good need good winter tires. Well, I'd get those anyway, but luckily I do have a family member that lives in St. John that has said I can stay there. I have other friends, like his former partner has also said I can stay with her if I ever need to. Um, he's going to get me a key to his apartment so that if I'm really exhausted, and he travels some for work, if I need to, I can like go and nap while if he's out and stay there, which I really appreciate. Also, the health authority will pay for a hotel for me during this period. I have a lot of people, you know, worried about that. They will actually pay for a hotel. For me, with a 2-year-old and just in my stage of life, I would prefer to come home every night. Um, where it's only if I were in treatment for 8 hours a day, I would stay, but the treatment itself is like 3 minutes, so I'm there for about 20 in total minutes with getting it lined up and everything. So for me, it just makes more sense to come home. I do wish that the healthcare system was a little more responsive to situations like mine, because they said like, we can get you a hotel for the 6 weeks if you're there 6 weeks, Monday through Friday, or nothing. And I'm like, could I have a hotel voucher for like storm days? So if there was a storm, they obviously can't guarantee like that the hotel would have room, but like if there's a storm and there are 3 nights, let's say, over the course of this 6 weeks, up to 6 weeks, could I have 3 nights? And they were like, well, it doesn't really work like that. I'm like, it's the annoying part of healthcare system, because if I was actually concerned, if I didn't have family there that I could stay with, then I could legitimately say, I want you to pay for 6 weeks of a hotel, and they would go, okay, and I would only use it 3 nights. Like, that's so silly. But yeah, I wish that there was a better intermediary of like, I don't want 6 weeks of a hotel, but could I get nights if I'm tired, or if there's a big snowstorm. Anyway, they did say they would try to work that out, that if something happened because the family member I'm staying with doesn't have like a spare room, I'd be like, he said like I would sleep in his bed and he would sleep on the couch. So that's not like the ideal situation. So yeah, so we'll see. They did say they were going to try to like work on that with me, because again, it makes sense. It's way cheaper to only pay for the nights I need rather than a 6-week stay. But anyway. Yeah, so this is gonna bump radiation back. I obviously have this guy for a little while, this vacuum, so that's very annoying. But I'm really going bonkers not working. So we'll see what I can do. I'm gonna try to like, I don't know, do something with my time at least, so I'm a little more active. I'm finding it really hard just mental health wise not having something to do. So I have kind of mentioned to my boss and said, you know, I know that during radiation everyone has said you're exhausted and you can't work. Although they said that about chemo too. And when I bring that up to people and be like, yeah, but I work through chemo, they're like, oh, then maybe you could work during radiation. So it just depends. But what I've kind of asked my boss, because I've been working retail and the busy time is obviously November and December, I've said like, look, when I hit the end of my medical leave, where we've had this period, if I'm feeling up to it, instead of extending the medical leave so I can't work, or making it that you put me on the schedule 3 days a week, could, where I've been there quite a while, you know, I've worked there over 6 years, over the past like 12, could we instead do, I'm an eligible employee to pick up shifts if able, because we know that over Christmas there's extra hours and we know people get sick. So could it be that I say, you know what, there's a shift tonight, I'm feeling well, and I could go in, because that's better than you counting on me to be there 3 days a week and I might not be able to. So she seemed to be open to that. You know, she just couldn't be a better boss. Like all the managers and everyone couldn't be better. So anyway, that is what my storage is saying low, so I'm gonna have to go soon. That's kind of what I'm planning on doing if possible. because EI will let me stay on EI and work part-time, and they just claw some of that back. So it's kind of probably the better scenario. So anyway, so to recap, 4 more lymph nodes have cancer, but none in the chest wall. That's great. And I have a vacuum buddy for a while, so that is fun. I have not driven with it yet. I haven't taken any codeine today. I did have to twice yesterday. I'm going to go out for a little while just to get out of the house because I go stir crazy. But yeah, I'm sure I will be filming content with this what is life like with a vacuum you're carrying. So anyway, thanks. Bye.